Let me ask you something personal. Has someone in your family ever been told they have dementia, and then, a few months later, the doctor came back and said, "Actually, it's Alzheimer's"? Or maybe it was the other way around, and you sat there, in that office, nodding, but quietly wondering, wait, are those the same thing? Did something change? Is it worse now? If that's happened to you, you're not alone, and if it hasn't, it will. Because at some point, someone you love will sit across from a doctor who uses one of these words, and you'll want to know exactly what it means. Here's the truth most people don't hear until it's too late. Alzheimer's and dementia are not the same thing. One of them is a disease, the other is a symptom. And confusing the two doesn't just create confusion, it can delay the right care, the right conversations, and the right decisions by months, sometimes years. Today, we're going to change that. So let's start with the word that gets used the most and understood the least: dementia. When most people hear that word, they picture one thing: an elderly person who forgets names, gets confused about where they are, maybe wanders off, and yes, that can be dementia. But dementia isn't a disease, it's a description. It's what doctors call a syndrome, a collection of symptoms that show up together and tell us that something is happening in the brain. Think of it this way: if someone tells you they're running a fever, that's not a diagnosis, that's a signal. The fever could be from the flu, from an infection, from a dozen different things. The fever itself isn't the problem, it's the body telling you something is wrong underneath. Dementia works the same way. Memory loss, confusion, difficulty with language, trouble making decisions, changes in personality, these are the fever. They're the signal. And just like a fever, what's causing them underneath can be very different from one person to the next. There are over 100 conditions that can cause dementia symptoms. Over 100. Most people don't know that. They hear the word and they think there's only one road ahead. But that's not true. And understanding what's actually happening underneath the symptoms changes everything about how you respond to it. Now, of all the conditions that cause dementia, Alzheimer's disease is the most common, by far. It accounts for somewhere between 60 and 80% of all dementia cases in the United States. So, it makes sense that people use the words interchangeably, but that doesn't make it accurate. And in medicine, accuracy matters. Here's a way to think about it that might stick with you. Dementia is like the word cancer. It tells you something serious is happening, but it doesn't tell you what kind, where, or how to treat it. Alzheimer's is like saying breast cancer or lung cancer. It's specific. It has its own biology, its own progression, its own particular fingerprint in the brain. And that distinction, that specificity, is what determines everything. The treatment approach, the medications that might help, the timeline, the conversations you need to have with your family, the plans you need to make. When you know what you're actually dealing with, you can respond to it clearly. When you don't, you're just reacting to fear. And fear, without information, is exhausting. So let's go deeper. Because Alzheimer's is not the only road dementia can take. There are 3 other forms that are far more common than most people realize. And each one shows up differently, affects different parts of who you are, and requires a different kind of attention. The second most common is vascular dementia. This one is caused by reduced blood flow to the brain, often after a stroke, or a series of very small strokes that can happen quietly without you even knowing. No dramatic event, no warning, just tiny interruptions in blood flow, over time, that slowly damage brain tissue. What makes vascular dementia different is how it tends to progress. Alzheimer's usually follows a slow, gradual decline. Vascular dementia often moves in steps, a period of stability, then a sudden drop, then stability again. If you've watched someone go through this and thought, they seemed fine, and then overnight something changed, that pattern is worth paying attention to. The third form is Lewy body dementia. This one is less well known, but it's more common than most people think. It's actually the third most common form of dementia overall. It's caused by abnormal protein deposits in the brain called Lewy bodies, and it affects not just memory, but movement, sleep, and even perception. People with Lewy body dementia sometimes experience vivid hallucinations, seeing things that aren't there, early in the disease. That can be terrifying for families who don't understand what's happening. And then there's frontotemporal dementia. This one tends to strike younger, sometimes people in their 50s or early 60s, and it doesn't start with memory. It starts with personality, behavior, judgment. Someone who was always gentle becomes irritable. Someone who was always careful starts making reckless decisions. It can look like a midlife crisis. It can look like depression, but it's something else entirely, for different roads, all leading to symptoms we call dementia, all requiring different maps to navigate. Quick note before we go further. Everything shared in this video is for educational purposes only. It's not medical advice, and it's not a substitute for a conversation with your doctor. If anything we discuss today raises a concern for you or anyone you love, please bring it to a qualified medical professional. That conversation could matter more than you know. I want to talk about something that most doctors don't have enough time to explain in a 15-minute appointment: the early signs. Not the obvious ones. Not the ones that show up when someone is already deep into the disease. I mean the quiet ones. The ones that appear years before anyone thinks to worrying. The ones that get explained away as stress, or age, or just having a lot on your mind. Because here's what I've come to understand through years of paying attention to this. The brain doesn't fail suddenly. It sends signals first. Small ones. Easy to miss. Easy to dismiss. And the people who catch them early, who take them seriously before there's an obvious reason to, those are the people who have options. So let's talk about what to actually watch for. And I want you to do something as I go through these. Don't just listen as if this is happening to someone else. Think about the people in your life. Think about yourself, not with fear, but with honest attention, because that's the only way this information becomes useful. The first signal is one we already touched on, but it deserves more time. Smell. Specifically, the ability to identify smells, not just detect them, but recognize them. There's a difference. You might still notice that something has a scent, but you can't quite place what it is. Coffee smells like something warm, but not quite like coffee anymore. You walk past a bakery and something registers, but the specific memory the smell used to trigger, it's just not there. This happens because the nerve that carries smell signals from your nose travels directly into the entorhinal cortex, one of the brain's primary memory centers, sitting right next to the hippocampus. And these are among the very first areas affected by Alzheimer's disease, long before memory problems show up in any obvious way. These regions can already be under stress. Researchers have found that people who score poorly on smell identification tests are statistically more likely to develop dementia in the following years. Not everyone, but the correlation is strong enough that neurologists take it seriously. So let's try something right now. I want you to close your eyes for a moment and think about these smells. Not whether you can smell them right now, just whether you can recall them clearly in your mind. Fresh coffee brewing in the morning, cinnamon, cut grass after rain, a rose, burning toast. Could you bring each one back clearly? Did any of them feel vague, distant, harder to place than you expected? This isn't a clinical test, but it's a useful moment of honest attention, because your nose might be picking up on something your memory hasn't noticed yet. If your sense of smell has quietly faded, and it's not coming back, and there's no clear reason like a recent illness, that's worth mentioning to your doctor. The second signal is one that breaks my heart a little every time I think about it. Apathy. Not sadness, not depression, something quieter than that, and in some ways harder to recognize. It's when someone just stops caring about the things they used to love, the Sunday morning routine they never missed, the hobby they'd talk about for hours, the grandchildren they used to call every week without being asked, and now, nothing. Not because something happened, not because they're upset. The interest just isn't there anymore. Families notice this before the person does. Almost always. They'll describe it as he's just not himself or she seems like she's somewhere else. And the person, if you ask them, will tell you they feel fine. And they mean it. Because apathy doesn't hurt. It just empties. I want to pause here and ask you something directly. Think about the person in your life you're closest to. Or think about yourself, honestly. In the last 6 months, have the things that used to bring genuine pleasure started to feel flat? Not sad, not painful, just less. Has anyone around you mentioned, even casually, that you seem less engaged than you used to be? You don't need to answer out loud, but sit with the question for a moment, because this is clinically significant. New onset apathy in later life, especially in someone with no prior history of depression, is recognized as a potential early marker of cognitive change. It falls into a category called mild behavioral impairment, and research has linked it to increased dementia risk. The cruel part is that because it doesn't feel like suffering, people don't seek help, they wait, and the window for early intervention gets smaller. The third signal shows up in language. Words. Specifically, the way someone reaches for them and misses. Everyone loses a word sometimes. That's not what I'm talking about. I'm talking about when the misses start adding up, when the gaps become a pattern, when someone starts substituting, calling the microwave the food heater, the remote control the telly thing, not once, but consistently, every time, without noticing they've done it. That last part matters most. When you notice you've lost a word, that's frustrating, but it's normal. When the people around you notice that your language has quietly changed, that your sentences trail off, that you've started replacing specific words with general ones, that's a different conversation. Now, I want you to try something. This is a test neurologists actually use in clinical settings, and I want you to do it for real, not just read past it. Pause the video right now, set a timer for 60 seconds, and name as many animals as you can out loud. Any animals? Go. How did you do? Most healthy adults over 60 will name somewhere between 15 and 20. If you got above 12, that's genuinely reassuring. If you found yourself stuck after 7 or 8, or circling back to the same ones, that's not a diagnosis, but it's a data point worth sharing with your doctor. And here's the subtler version of this test that I find even more revealing. While you are listing animals, did your mind feel fluid? One word leading naturally to the next? Or did it feel like pushing through something, like the words were there, but the path between them was harder than it should have been? That quality of mental fluency, not just what you produce, but how it feels to produce it, is something worth paying attention to over time. Language is one of the last things we think to protect, but it's one of the first things the brain quietly rearranges when something is changing underneath. And if someone who loves you has mentioned, more than once, that you seem to be searching for words more than you used to, listen to them. That observation, offered with love, might be worth more than any test result. We've talked about smell, about apathy, about language. Now I want to talk about something you can actually see. Not in a lab, not in a scan, just by watching someone move through a room. Walk with me for a moment. Think about someone you know well, a parent, a spouse, a close friend. You've watched them walk 1,000 times, down a hallway, across a parking lot, into a room, and somewhere along the way, without realizing it, you memorize their rhythm, the way their weight shifts, the timing of their steps, the particular way they carry themselves. Neurologists call this your motor signature, and it's more connected to your brain than most people ever think about. Walking, when it's working the way it should, is almost entirely automatic. Your brain handles it the way it handles breathing, in the background, without effort, without conscious thought. But when the brain's wiring begins to change, walking stops being automatic. It starts requiring attention. And that shift, subtle as it is something a trained eye can detect years before a formal diagnosis. Here's a simple version of the test I'm describing. Walk across a room, normal pace, nothing special. Now do it again, but this time, count backwards from 100 by 7s while you walk. 100, 93, 86, 79. For most healthy brains, Both tasks run simultaneously without much interference. You walk and you think, and neither one suffers significantly. But when cognitive reserve, the brain's spare capacity, begins to shrink, something interesting happens. The brain has to choose, and it often chooses thinking over walking. So you slow down, you shuffle slightly, you might even stop mid-step without realizing it, because your brain quietly prioritized the math. This is called dual task interference, and researchers have found it can appear 10 to 15 years before a dementia diagnosis becomes clinically obvious. 10 to 15 years. That's not a small window. That's a decade of time. Time to make changes, have conversations, explore options, prepare. The question is whether you're paying attention early enough to use it. Now, slowing down with age is normal. Please hear that clearly. Not every change in your walk is a warning sign. What matters is a shift in your pattern, a change from who you were. And, again, whether the people closest to you have noticed it before you have. Because the people who love us are often our best early warning system. They see us clearly, sometimes more clearly than we see ourselves. And when they say something has changed, even gently, even hesitantly, that deserves more than a dismissal. And speaking of people who show up for each other, if you've made it this far into this video with me, I want to take just a moment to say something directly. This kind of content takes time to research, to write, to get right. And the only reason we keep doing it is because of people like you. People who take their health seriously, who show up, who want to understand what's actually happening in their bodies and their brains before someone else tells them they have to. So, if this channel has been useful to you, if even one video has made you think differently, or ask a better question at your next doctor's appointment, I'd love for you to subscribe. Hit that button, turn on notifications, and come back. Because we do this every week, and the conversations we're building here are exactly the kind that most people aren't having anywhere else. For those of you watching with a spouse, a sibling, a parent in mind, share this. Send it to them, not to scare them, but because information, given with love, is one of the most protective things one person can offer another. Now, the fifth and final signal. And this one, I genuinely wish more people knew about. It happens at night, while you're asleep, and the person most likely to notice it isn't you. It's whoever shares a bed with you. It's called REM sleep behavior disorder, and the name sounds technical, but the experience is anything but abstract. Normally, when you enter REM sleep, the stage where dreaming happens, your brain sends a signal that essentially paralyzes your muscles. It's a protective mechanism. You dream about running, but you don't actually run. You dream about an argument, but you don't actually shout. In REM sleep behavior disorder, that protective switch fails. So you do move. You thrash. You shout. You kick. You might throw a punch at something that isn't there, or fall out of bed entirely. And when you wake up, you remember none of it. Your partner, however, remembers all of it. Here's why this matters so much in the context of what we've been discussing today. REM sleep behavior disorder, one of the strongest early biological markers we have for Lewy body dementia. One of the 4 major forms we talked about earlier, and it can appear years, sometimes an entire decade, before any cognitive symptoms become detectable. A decade. That's not a footnote. That's a headline. Because if someone you love is thrashing in their sleep, shouting, acting out vivid dreams on a regular basis, and it's new, and it's getting more frequent, that is a conversation worth having with a neurologist. Not tomorrow. Soon. So, let's bring it all together for a moment. 5 signals. None of them are memory loss, a fading sense of smell, a quiet withdrawal from life, words that slip and don't come back, a walk that requires more thought than it used to, dreams that escape the body at night. On their own, each one of these could be explained away. And honestly, on their own, they probably should be. Because aging is real. Bodies change. Brains change. Not every shift is a warning sign. But here's where I want you to sit with me for just a moment. There's a difference between fear and attention. Fear paralyzes. It makes you avoid the doctor's office because you're afraid of what you might hear. It keeps you frozen in a place where nothing can change because you've decided, quietly, privately, that it's already too late. Attention is different. Attention is what lets you notice something early, bring it to someone who can help, and walk out of that appointment with options instead of shock. Attention is what gives you time, and time, in the context of brain health, is one of the most valuable things you can have. I want to pause here and ask you to do something simple. Think about the 5 signals we talked about today. Just run through them quietly in your mind. Smell, drive, words, walk, sleep. For each one, ask yourself honestly, has anything shifted in the last year or two? Not dramatically, just ... differently than before. And has anyone around you mentioned it, even in passing? You don't need to answer out loud, but notice what comes up when you ask the question without rushing past it. That honest moment of attention, right there, is exactly what most people skip. Now, the research on early intervention is genuinely encouraging, not because there are cures, there aren't, not yet, but because the earlier something is identified, the more tools exist. Medications that work better when started early, lifestyle changes, sleep, exercise, diet, social connection that have real, measurable impact on brain health before significant damage has occurred. Conversations with family that are infinitely more meaningful when you can participate in them fully, on your own terms. Early attention doesn't steal your peace, it protects it. There's something else worth saying, something that doesn't get discussed enough. In almost every story I've come across, in research, in personal accounts, in the quiet conversations people have when they finally feel safe enough to have them, there is almost always someone who noticed first. A spouse who mentioned, gently, that something seemed off. A daughter who noticed her father had stopped laughing at the things that used to make him laugh. A friend who asked, quietly, "Are you okay?" and didn't accept Fine as a complete answer. These people are not alarmists. They are paying attention with love. If you are that person for someone, if you've been carrying a concern you haven't said out loud yet, I want to give you permission to say it, not as a diagnosis, just as an observation, offered with care. I've noticed something. I might be wrong, but I love you enough to mention it. That sentence, said with kindness, might be the most important thing you say this year. And if you are the person being watched, if someone who loves you has tried to bring something to your attention and you've brushed it off, I want to ask you, gently, to consider why. Is it because you genuinely believe nothing is wrong? Or is it because some part of you already knows something is changing, and hearing it from someone else makes it real in a way you're not ready for? Both answers are human, completely human, but only one of them moves you forward. The moment you're waiting for to take your health seriously, it's not coming as a calendar event. It's right now, while you still have time, and clarity, and choice. You matter. Your brain matters. The version of you that exists 10 years from now. The one who remembers, who recognizes, who stays present for the people you love. That version is worth protecting today, not tomorrow. Today, I want to tell you something before we finish. Not as a doctor, not as someone with research and statistics and clinical language at their fingertips. Just as someone who has spent a long time paying attention to what happens to people when they wait too long, and what happens to them when they don't. We started this conversation with a question. Do you know the difference between Alzheimer's and dementia? And maybe you came here thinking you did. Or maybe you came here because someone in your life was just given one of those words and you needed to understand what it actually meant. Or maybe, and I think this is true for more people than will ever admit it, you came here because something quiet has been happening, something you haven't said out loud yet, something you've been carrying alone, hoping it would go away on its own. I see you. Whatever brought you here today, I want you to leave with something more than information, because information, on its own, is just noise until it connects to something real, until it lands inside a life that's actually being lived, until it meets a person who is willing to look honestly what's in front of them and decide, consciously, deliberately, what to do next. So here is what I know to be true. Dementia is not one thing. It is many things. It wears different faces, moves at different speeds, touches different parts of who a person is. Alzheimer's is the most common of those faces, but it is not the only one. And knowing which face you're looking at changes the entire conversation about what comes next. The brain does not fail in silence. It sends signals. Small ones, early ones, quiet ones. A smell that fades, a spark that dims, a word that floats just out of reach, a walk that requires more effort than it used to, a night that becomes something your partner fears more than you know. These signals are not sentences. They are not verdicts. They are information. And information, received early, with open eyes and a steady heart, is one of the most powerful things a human being can hold. But here's what I really want you to take with you. The people who do best, in every area of health, not just brain health, are not the ones who know the most. They are the ones who act on what they know, who make the appointment, who have the conversation, who say the thing they've been afraid to say, who listen when someone who loves them tries to tell them something important. That gap between knowing and doing is where most of the loss happens. Not in the disease itself, but in the delay before anyone decided to take it seriously. You've spent 30 minutes here today. That means something. It means you take this seriously. It means you're willing to sit with information that isn't easy, because you understand that easy and important are rarely the same thing. Now I'm asking you to take one more step, not a dramatic one, not a frightening one, just one. If something in this video resonated with you, if you recognized a signal, in yourself or in someone you love, write it down, just that, write it down, and bring it to your next doctor's appointment, not as a self-diagnosis, not as a conclusion, just as a question. I noticed this. Is it worth paying attention to? That question, asked calmly and clearly, opens doors that silence keeps shut. And if nothing in this video applied to you directly, if you watch this for knowledge, for preparation, for the quiet act of taking care of yourself before you have to, then you've already done something important. You've paid attention. In a world that moves fast and rewards distraction, paying attention to your own health is a radical act. Keep doing it. There's one more thing I want to say. And it's the thing I think about most when I consider why conversations like this one matter. Somewhere out there, someone is watching this video right now, and they are thinking about their mother, or their father, or their husband of 40 years, and they are scared, and they feel alone in that fear, and they haven't told anyone yet because they don't want to be wrong, or they don't want to upset anyone, or they don't quite have the words yet for what they're seeing. To that person, wherever you are, whatever time it is, whatever you're carrying tonight, you are not wrong to pay attention. You are not overreacting. Love notices things, and what love notices deserves to be taken seriously. Say something to a doctor, to a family member, to anyone who can help you take the next step. The conversation you're afraid to start might be the one that changes everything. The brain is extraordinary. Even as it ages, even as it changes, even under pressure, it fights for you. It compensates. It adapts. It finds new paths when old ones narrow. Give it the chance to do that work. Give yourself the chance. If this video meant something to you today, I'd ask just one thing. Share it. Not on a timeline, not for an algorithm, but with 5 specific people in your life who would benefit from hearing this. A parent, a sibling, a friend who's been quieter than usual lately, someone who needs this information and doesn't know yet to look for it. And subscribe to this channel, because this is what we do here. Every week, we have the conversations that matter, the ones that are uncomfortable enough to avoid and important enough that you can't afford to. Leave a comment below. Tell me honestly, did anything in this video resonate with you? Did you recognize something? And tell me what you want to talk about next. This channel belongs to you as much as it belongs to me. So tell me what you need. I'll see you in the next one. Take care of your brain. It's the only one you have.